Medical gaslighting. Is your doctor mentally manipulating you? My story, short version. I had been with my primary care physician for 10 years, and for 3 years, I had been telling her of my medical concerns. I was concerned about my neck getting larger. My choker necklaces would not fit around my neck anymore. I was having trouble swallowing. My weight was up and down like a yo-yo. I was snoring to the point I was waking myself up. I was constantly tired. All I wanted to do was sleep. My hair was falling out. My skin was dry as sandpaper, and I was finding it difficult to focus. I had developed anemia. My joints and muscles ached. During the 3 years, I was told I was stressed. I should drink more water. I was told to stop using soap that dried out my skin and use a more hydrating lotion. I was told to cut back on carbs. She examined my neck and told me, it's just a muscle. During the 3 years, I was given vitamin infusions once a month to help with the fatigue. It did not help. Ladies, I am not a dumb woman. I know my body. My intuition and instincts told me that something was seriously wrong. But this was my doctor for 10 years, and I trusted her. I thought female doctors would be more understanding and compassionate towards a woman's health concerns. The day she told me the symptoms I was having were all in my mind was the day I told that bitch to kiss my ass. I have my share of problems, but I ain't crazy. I got rid of her and started seeing another physician. I talked to him about my concerns, and he really listened. I took all the tests he ordered for me. Turns out I had hyperthyroidism. My thyroid needed to be removed, including the parathyroid gland. I needed immediate surgery. The surgeon who performed the surgery removed 3 goiters. 1 was the size of a baseball, and 2 were fused together. I suffered for 3 years. I now have to take levothyroxine for the rest of my life. Ladies, when it comes to your health, never let a physician or anyone in the medical health field try to convince you that you are crazy and that your symptoms are all in your mind. Get a second, third, or fourth opinion if you have to. You know your body better than anyone else. Trust your intuition, your instincts, and your gut feelings. Before we start the video, let's take a moment to reflect on how wonderful and brave you are with a short affirmation. I want you to clear your mind and take a deep breath, then release it. Now, with feeling, tell yourself, no one knows me better than me. I will not allow anyone to make me feel inferior. I will prioritize my health. I will take whatever steps I need in order to safeguard my health. I have the right to be respected. I have the right to be heard. Now, give yourself a big hug and say to yourself, I love you. Let's begin your journey to positive habits. It all starts with you. Enjoy the video. Picture this. You are a woman clutching your chest in pain, barely able to breathe, and yet, when you reach the hospital, you are told it is probably just anxiety. Sounds unbelievable, right? Yet, this experience is far from uncommon. A whopping 71% of American women, nearly 3 out of every 4, are dealing with a similar scenario. This perplexing situation has a name: medical gaslighting. It is a real deal, and it is not getting the attention it deserves. So, what is medical gaslighting, you ask? Think of it as when a doctor brushes off your health concerns, blaming them on stress, anxiety, or worse, your imagination. This is not just a minor nuisance, but a potentially life-threatening practice. When serious conditions are misdiagnosed or not diagnosed at all, it is the patient's health that pays the price. The stats are downright scary. A 2022 survey revealed that 72% of female participants claimed they have faced medical gaslighting. It's alarming how commonplace the issue is, particularly considering the silent suffering it brings about. To add another layer to this, consider chronic pain, a villain that tends to target women more often. Conditions like endometriosis, exclusive to women, can become a breeding ground for chronic pain. However, it becomes even tougher when their genuine pleas for help are dismissed, resulting in a much longer and painful journey toward diagnosis and treatment. The plot thickens when you take into account heart disease, the #1 killer of American women. You would think women reporting chest pain would get immediate attention, right? Wrong. These women are typically left in waiting rooms for longer periods and are less likely to get admitted to the hospital for further checkups. It gets even messier for women of color who, statistics reveal, often get an even shorter end of the stick. So the situation we have on our hands is not just an issue. It is a full-blown crisis that requires immediate attention. This is why we are going to dig deeper into this rabbit hole. Let's examine the roots of medical gaslighting, its implications, and, most importantly, how we can fight it. It is high time we flipped the script, giving women the proper care and respect they deserve in the healthcare system. The roots of medical gaslighting. You see, the problem does not stem from a singular source. It is a web of intertwined issues. The first root we must consider is the societal structure of gender roles. Historically, women have been perceived as emotionally expressive, sometimes even overly so, leading to the damaging stereotype that women are more prone to hysteria or psychological issues. Consequently, when a woman presents physical symptoms, there is an unfortunate tendency to place them under the psychological umbrella, attributing their complaints to mental or emotional stress. This predisposition to equate women's symptoms with psychological origins, which is deeply ingrained in societal norms, unfortunately, finds its way into medical practices as well. Then comes the role of unconscious bias. Though most healthcare professionals genuinely aim to provide the best care, unconscious biases can unknowingly influence their judgment. When a woman's symptoms are seen through a lens clouded by bias, her legitimate health concerns might be dismissed or minimized, leading to inadequate treatment. The healthcare system itself also plays a pivotal role in this issue. It is no secret that the medical system is often overburdened, with doctors having to manage large caseloads in minimal time. Under these circumstances, doctors might be inclined to take shortcuts, leading to quick, possibly flawed diagnoses. If a doctor believes, consciously or unconsciously, that a woman's symptoms are likely psychological, they might hastily attribute her complaints to non-physical causes without thorough investigation. Next, we encounter an alarming deficiency in medical education: the lack of emphasis on understanding gender differences in symptoms, particularly in diseases like heart disease and autoimmune conditions. Medicine is often taught from a male-centered perspective, leading to a lack of knowledge when it comes to recognizing and diagnosing conditions that present differently in women. This gap in knowledge can result in doctors misinterpreting or overlooking symptoms in female patients, thus adding to the gaslighting problem. Without adequate research, the medical understanding of diseases in women remains incomplete, contributing to the potential for misdiagnosis and resultant gaslighting. To better show you the male-centric perspective in medical education, let's consider heart attacks, a condition known to present differently in males and females. The classic symptoms of a heart attack we often hear about, such as extreme chest pain or discomfort and pain radiating down the left arm, are based on studies primarily involving male subjects. As a result, these symptoms have been widely taught in medical schools and are firmly imprinted in the minds of healthcare professionals. However, in women, heart attacks can often manifest differently. Instead of the typical crushing chest pain, women might experience symptoms such as shortness of breath, nausea, vomiting, back or jaw pain, and extreme fatigue. These symptoms, unfortunately, can be easily mistaken for less life-threatening conditions like acid reflux, the flu, or just general stress, particularly when physicians are not adequately trained to recognize the gender-based variation. So, when a woman arrives at the ER with these atypical symptoms, it might not immediately ring the heart attack alarm bells in a doctor's mind. This could result in critical delays in diagnosis and treatment, and, in some instances, the dismissal of the woman's symptoms as anxiety or stress, a classic example of medical gaslighting. This all ties back into the gap in medical education, which often fails to stress enough on the importance of understanding the gender differences in symptom presentation. This is horrifying to hear, I know. And now imagine how many females suffer due to this every day. How many of those still don't know that they've been misdiagnosed, and now a grave disease is consuming them without them knowing? So, what to do? Until our healthcare system catches up and tackles this issue head-on, you've got to protect yourself. Let's discuss some strategies that could help you steer clear of any serious consequences of medical gaslighting. This is how you can avoid being medically gaslighted. Educate yourself. Knowledge is power, right? So make sure you know your stuff. Learn about common health conditions in women, their symptoms, and how they might differ from those in men. The more you know, the better you can communicate your concerns to your doctor. Find the right doctor. A good doctor is not just someone with a bunch of degrees. It is someone who really listens when you talk. They respect your input and take your concerns seriously. If your current doctor is not doing that, do not be afraid to find a new one. Remember, your doctor works for you. Second opinions are gold. Let's say you have got a nagging feeling that your doctor might be dismissing your symptoms. Don't hesitate to seek a second opinion. Sometimes, a fresh pair of eyes can catch what the first pair missed. Stand up for yourself. You know your body better than anyone else. If you feel something is not right, don't let anyone convince you otherwise. Ask questions, demand answers, and don't stop until you are satisfied. You deserve to be taken seriously. Prioritize. It is no secret, doctors are busy people. So when you go to an appointment, be ready with a list of your most pressing concerns. Don't hold back. Speak up about what is really bothering you. You should always share each one of your concerns to make sure you are properly diagnosed. Keep asking. Don't be shy about repeating your questions or concerns. If you feel you are not getting the attention or care you need, say so. It is your health on the line, and you have every right to make sure it is given priority. So never ever feel embarrassed or ashamed to ask again and again. Nothing is worth shying away from when it comes to your health. Please remember this. Taking action is not just about changing the system. It is about you standing up for your rights and making sure you get the care you need and deserve. Don't ever let anyone dismiss your pain or tell you it is all in your head. Here are actual photos of what was removed and taken by my surgeon. 3 goiters, aka muscles, and 1 parathyroid gland. That was all for today. I hope this video helped you in every way you expected it to. Have you ever felt dismissed or disregarded by a healthcare provider? Have you ever experienced medical gaslighting? Do you have any personal tips or advice to share that can help someone? Share your story and your thoughts with me in the comment section below. Don't forget to like and subscribe for more content on loving yourself with positive habits from the Habitude Project. Stay positive and never give up on yourself. Thank you so much for watching.